Aloha and welcome to my presentation on endometrial cancer. Endometrial cancer typically involves several genetic mutations in endometrial cells. The most commonly detected is type 1. Endometrial cancer is when cancer cells arise in the glands of the endometrium, which is the lining of the uterus. Typically, endometrial cancer is the result of too much estrogen in the body. Excessive estrogen can result from obesity or taking tamoxifen, which is a breast cancer medication that blocks estrogen receptors in the breast but stimulates them in the uterus, and postmenopausal estrogen therapy without a progestin to balance it out. The 5-year relative survival rate for endometrial cancer is 82%. This means that out of every 100 women diagnosed with endometrial cancer, 82 will still be alive 5 years after being diagnosed. It's most commonly diagnosed in women aged 55 to 64. White women have the highest incidence rate. However, the death rate for Black women is much higher. Lack of medical coverage and unequal access to cancer treatment contribute to this disparity. If your mother gave birth to you, your first home for 9 months was the uterus. The uterus is a hollow organ that sits behind the urinary bladder and in front of the rectum. The wall of the uterus has 3 layers, and one of those layers is the endometrium. The top of the uterus above the openings of the fallopian tubes is called the fundus, F-U-N-D-U-S. This section below the openings is called the uterine body. The uterus tapers down into the uterine isthmus, and finally the cervix, which protrudes into the vagina. Symptoms of endometrial cancer are any abnormal vaginal bleeding, postmenopausal bleeding, unexpected weight loss, enlargement of the uterus, and pain during intercourse. 1/3 of women that experience postmenopausal bleeding will be diagnosed with endometrial cancer. The top risk factors are obesity, late menopause, diabetes, high blood pressure. Additional risk factors are never having been pregnant, chronic anovulation, that's when the ovaries don't release an egg during a menstrual cycle, and having many menstrual cycles. Also, a hereditary condition called hereditary non-polyposis colorectal cancer causes a high risk of developing colon cancer and endometrial cancer. But there are factors that protect against type 1 endometrial cancer. 1, taking birth control pills. 2, being older at the time you give birth, and breastfeeding. Diagnosis is determined through a transvaginal ultrasound to see if endometrium is abnormally thick, then a biopsy of the endometrial cells to confirm the diagnosis. An endometrial biopsy has 90% accuracy. With endometrial cancer, there are 4 stages. Stage 1 is where the cancer is only in the uterus. Stage 2 is where the cancer has spread to the cervix. Stage 3 is where the cancer has spread outside the uterus. And stage 4 is when the cancer has spread beyond the pelvis. If detected in stage 1, the prognosis is good. Treatment for endometrial cancer is a total abdominal hysterectomy. A total hysterectomy consists of the removal of the uterus, both ovaries, cervix, and both fallopian tubes. If advanced, patient will undergo radiation and chemotherapy following surgery. And that's my presentation on endometrial cancer. Mahalo for listening.